Katie. My name's Emily. I'm going to be your student nurse today. Before we get started, can you just verify your name and date of birth?
Yeah, Maisie Lee, 5/20/1998.
Perfect. Okay. And are you having any pain right now?
Nope.
Okay. Awesome. Great. So we're going to get started. I made sure to wash my hands. First, I'm going to do a skin assessment. So I'm just going to check to see generally how her skin turner is. I'm going to pinch that. Great, she has great rebound with that. I'm gonna look behind her neck. There's no lumps, bumps, masses, or bruises. Palpate the skull. And checking for any lesions or lice. Great, so Maisie is free of all those. I'm gonna check her cap refill. Awesome, less than 3 seconds. Her skin was warm to touch. Everything was normal color, and her nails and skin looked great. She had no edema. I'm just going to check her lower extremities too for any edema. Okay. Awesome, so she's free. Well, edema on both sides. If you could just shake your head yes, and then no. Great, so range of motion is good and equal bilaterally on both sides. So next I am going to inspect her eyes. So first, I'm just going to turn on my light, and if you could just stare at me. Okay. Awesome, and then I'm just going to do the other side. Great. And then I'm going to take my pen, and then if you could just follow it. Beautiful. So eyes are equal, round, and reactive to light. I'm just going to check her peripheral vision really quick. So if you could cover one eye, one hand, yep. And then just let me know when you can see my fingertips.
You too.
Yep, okay. And then switch. Yep, perfect. And then I'm just gonna go behind you, do that one more time. So one eye.
Yep.
Okay, then the other.
Yep.
Perfect. Just gonna inspect her ears really quick. Again, looking for any lumps, bumps, or masses. Especially for any skin cancers or melanoma. That tends to happen around the ears as well. Put pressure on her tragus. Same on the other side. Okay, everything looks good and free of lumps, bumps, and masses. I'm going to do the whisper test. So if you could just repeat back to me what I say.
Bland.
And then the other side.
Coffee.
Awesome. Next, I'm going to inspect her nose and palpate her lymph nodes to make sure there's no swelling. So I'm just going to palpate really quick. Is there any pressure or pain when I do this? Okay. And I'm just going to go down to each lymph node area. Any pain?
Nope.
Okay, and other side.
All good.
Okay. And I'm just gonna look inside her nose and mouth, say ah.
Ah.
Perfect. Everything looks equal. No lumps, bumps, or masses. Okay, she also had no vein distension on her neck or on her face. And her trachea is in alignment. I'm just gonna palpate that really quick as well. Great. So if I could just have you stand up really quick, and you could face the window. So her back looks like it's in normal alignment. Doesn't look like she has any scoliosis, kyphosis, or lordosis. First, I'm just going to palpate her spine quickly. Okay, everything's in alignment. And if you could just bend over, touch your toes really quick, and then stand back up. Great, so that was all even in one line. You can sit back down. Okay, next I'm going to move on to the respiratory system. So first I'm going to auscultate and then make sure her breathing is even and non-labored. So every time I put my stethoscope over your chest, just take a deep breath in and out. And then on the posterior side. Great, so Maisie, everything sounds great. Nothing is wheezing or asthmatic. Lung sounds are clear to auscultation. They're also even and unlabored and has respirations of 12 respirations per minute. And I'm just going to check her cap refill again to make sure everything is perfusing. Great, it's less than 3 seconds. Okay, next I will do the cardio assessment. So I'll do ape to man. So going from apical to the pulmonic, Herb's point, to tricuspid, and then to mitral. Okay, everything sounds good. S1 and S2 noted. No brutes or whooshing sounds, and heartbeats sound regular. She has a heartbeat of around 70 beats per minute. Okay, then I'm just going to check her pulses peripherally. So first I'll do her carotid, doing one side at a time so she doesn't pass out. Okay, pulse noted. Noted, and then I'll do radial on both sides. Okay, equal and bilateral. Her pedal. And then her post-tib. Great, and all pulses were +2 equal bilaterally. Then I'm going to do the abdomen inspection. So if you could just lie on down. Great. And when was your last bowel movement?
This morning.
Okay, great. And you're tolerating your diet well?
Mhm.
Okay, awesome. First, I'm going to listen. And I'll go to each quadrant for at least 5 seconds. Okay, so bowel sounds noted in all 4 quadrants. If I didn't hear any bowel sounds, I would just listen for 5 minutes to make sure things are working properly. Okay, so I'm just gonna palpate lightly first. Any pain? So no distension. And then I will progressively move to deeper palpation. Any pain there? Awesome. Awesome. So she can sit back on up. Just see your range of motion really quick. So if you could bring your arms up to a T, and then up over your head, back down to a T, and down by your side. Nice, and then straight out in front of you. Great. If you could extend your right leg, and back down, left leg, back down. And can you circle your ankles clockwise, and then the other way? Beautiful. And if you could stand on up, and then extend your right leg, back down, left leg, back down. Okay, awesome. All set with range of motion. She is strong and balanced, and everything is equal. Okay, next I am going to do a neuro assessment. So this whole time, Maisie has been awake, alert, and oriented. Her speech has been clear, but first I'm gonna test her short-term memory. So if you could just repeat these 3 words back to me: red tree plant.
Red tree plant.
Okay, great. So everything is clear, and her short-term memory is great. Next, I'll focus on your gait. So if you could just stand up and then walk towards me, right? And then the other way. Beautiful. So gait is normal. She can walk great. And if you could just stand with your hands by your side and close your eyes, doing the Romberg test, making sure she is steady for 5, 4, 3, 2, 1. Great, perfect. And sit back down. So before I leave the room, I make sure the side rails are up. Maisie has her call bell, and just make sure she doesn't need anything else for the day or right now in this moment. Awesome. So I would wash my hands and leave the patient's room.